Hi, my name is Abby Grayjack, and I am a junior studying mechanical engineering at the University of Michigan. This summer of 2011, I worked in the SHARE program under Dr. Ellen Aruda, Dr. Lisa Larkin, and PhD candidate Jinjin Ma. This program exposed me to a branch of mechanical engineering known as biomechanics, application of mechanical principles to biological systems. Specifically, this summer I learned how to characterize the mechanical properties of bodily tissue such as ligaments and tendons. One of Professor Aruda's core projects that I helped with this summer was engineering tissue to act as a suitable replacement for an ACL. ACL is short for Anterior Cruciate Ligament and is one of four main ligaments that stabilize the knee. The ACL connects the lateral condyle of the femur, which is the outside of your thigh bone, to the front of the tibia, which is your shin bone. The PCL, or posterior cruciate ligament, connects the medial condyle of the femur, which is the inside of your thigh bone, to the back of the tibia. Along with the PCL, the ACL helps to restrict the joint's movement to the familiar back and forth motion by limiting translational movement. Tearing of the ACL is a common injury for many athletes. Currently, the most common way to repair an ACL is through tendon grafts. There are two main types of these grafts, an autograft and an allograft. An allograft is replacing the ACL with tissue from a deceased person or cadaver. An autograft is replacing the ACL with the patient's own tissue, specifically parts of the patient's own hamstring muscle tendon or patellar tendon. While current methods for ACL reconstruction are quite successful, there are many risks involved as well as a long recovery time. As with any surgery, the risks of blood clots and infection are present. Without proper physical therapy, many patients develop stiff knee. But even with the exercises, pain and instabilities can linger, and there is always a risk of the graft itself tearing. The lab I worked in this summer is on its way in finding a better replacement for the ACL by engineering tissue from bone marrow stromal cells. They call it a BLB, or bone ligament bone construct. Its composition is exactly its name, ligament tissue with bone tissue at both ends. Ideally, the engineered bone tissue would fuse to the upper femur and lower tibia as a normal ACL would, with the ligament tissue in between. My summer research experience can be organized into three categories: cell culture and BLB construction, material testing, and test analysis. The first part of my research experience was learning basic cell culture and constructing my own BLB construct. There are four main steps to cell culture and BLB construction. First, cells are isolated from collected bone marrow and distributed into petri dishes according to calculated ratios based on the amount of cells extracted. The isolated cells are then differentiated into bone and ligament cells using specified growth factors. Next, the cells are fed and passaged. Passaging is the process of dividing the cells into more dishes, giving them more room to multiply. The cells are passaged until the proper plating cell density has been reached. Finally, the cells are plated to create ligament and bone monolayers. A monolayer is a 2D layer of cells that covers the bottom surface of the dish. The BLB 3D construct is then constructed using these monolayers by pinning them on special dishes to the lengths desired. These dishes have a polymer coating along the bottom called Silgard, which allows the pins in the BLB to be secured. The second part of my experience was mechanical testing. With my BLB construct, I performed an in vitro experiment to test the BLB's viscoelastic property. Viscoelastic refers to a material's time-dependent force response. To test this property, I used a customized tensiometer. A tensiometer uses a voltage sensor to measure the force present in a sample as it goes through a series of uniaxial tension tests and stress relaxation tests. This instrument uses LabVIEW programming to both run various tests and record the force data. Before testing, tracking markers are applied to the surface of the samples, and pictures are taken during the test for strain analysis. The third part of my experience was analyzing the data from my experimental tests. This basically involves using software to track the displacements of the different areas of the sample and plotting the stress and strain data into curves. The software I used is called Metamorph. Using the tracking markers on the sample, Metamorph runs through the pictures taken during the testing and traces the tracking markers changing location. The location traces are outputted into an Excel file, where I can then calculate their displacements and from that, the resulting strain. To me, the SURE program was a great learning experience. I would definitely recommend this program to any aspiring engineer who is unsure about research, graduate school, or their career interests after school. The SURE program definitely opened my mind to research and gave me a chance to explore a field I was unfamiliar with but very interested in learning about. I definitely want to continue learning and working in biomechanical research in the future. Thank you.